Today is August 19th, 2024, and yet countries are now preparing for additional lockdowns. And no, this has nothing to do with COVID. We are now hearing about a new national health emergency. This is going to be global, according to many experts. But here's what you need to understand. The U.S. is experiencing additional cases. The Philippines, same thing, experiencing additional cases and from people that have yet to travel, and it's all because of Mpox. Now, I want to address what's going on, what the World Health Organization is saying, what experts are telling us, and what you should be concerned with living here in the United States. So I'm going to break all this down in just a moment, but all I ask is one thing. It takes 2 seconds. Go ahead, hit that like button if you enjoy these daily updates, and now let's begin. So let's address the big question in the room. Are we about to experience additional lockdowns? Well, according to experts in India, they are already preparing airports and ports of entry to be prepared for lockdowns, to quarantine anybody, and I mean anybody, that looks like they have Mpox. Just look at this. It says the World Health Organization Director General declares Mpox outbreak a public health emergency of international concern. And they are not stepping back from that. They're actually ramping up. Look at this. It says Mpox outbreak. Center sounds alert at all airports, border land ports as well. Now, I want to read a little bit of this to you. It says New Delhi. The Union Health Ministry has instructed all airports and land ports on the borders with Bangladesh and Pakistan to remain vigilant for international passengers showing symptoms of Mpox. Okay? This is not going to stop. What we have learned over the past handful of years is how to deal with a potential pandemic. Now, did masking work? It helped, yes. But did it prevent COVID from spreading? Yeah, a little bit. Did vaccines work? Yeah, a little bit. But was there a lot of studies done to say that yes, they didn't work? Yeah. But here's what we know does work. Making sure the public understand the risks. Making sure that yes, if you have Mpox, you quarantine yourself. Simple as that, right? That's it. It's nothing too scientific, just quarantine. Just wait. Be patient. Now, why do I say this? Well, it's because of this. A man with no travel history is the first Mpox case in the Philippines since December. Now, how could somebody that didn't travel to, the DRC, how did they get Mpox? That's the big question. And this is what many people are waiting for answers on. How does this really transmit from one person to another? How's it carried? Does it go through wastewater? These are all questions people are asking. But yes, scientists don't have a lot of answers just yet. It's still something they're learning. And the reason why they're learning this is because it's a new variant. Look at this one. It says Mpox cases on the rise in South Florida. How the newest variant differs from the one in 2022. It says doctors in South Florida could be more susceptible to disease spread because it's an international destination. That's key. You know what else is an international destination? The United States. The entire United States. Not just Miami, not just Los Angeles, not just San Diego and Chicago and, Denver, New York, right? Everybody, every place. Everybody's just moving around. I want to read a little bit of this to you. Look at this. It says, doctors say the new Clade 1 variant is deadlier and seems to be spreading faster than Clade 2 did during the outbreak in 2022. That spread across the world, including South Florida. Unlike Clade 2, the Jackson Health System says 75% of cases involving Clade 1 are in children. Why would children get this virus a little bit easier than adults? Well, it's simple. Children have a weakened immune system, just like the elderly. So they're more susceptible to catching this virus. Here's the other reason. Children like to put their hands on everything. They'll touch doorknobs and they'll touch different handrails. They'll wipe their hands on walls, right? Some are even licking the handrails. They're kids. That's what they'll do. So that's why they're able to contract this virus a little bit easier. But I want to show you this one as well. Could the new Mpox threat cause significant harm in the U.S.? It says an apparently more dangerous strain of the Mpox virus is circulating rapidly in a number of countries, with the first reported cases outside of Africa reported this week in Sweden. Yeah. The U.S. is at risk. The reason why the U.S. is at risk for multiple reasons. Number one, we have so many people still entering into the United States. Our borders are not secure. People still come across the borders and come into the U.S. through plane, through boat, right? Some swim, right? There's so many ways you can get in. But that's one of the reasons why we're at risk, is because we don't know where people are really coming from, where they've been, their health conditions, right? These are all things we don't know. But I want to show you something else. One of the things that I got a lot of questions on just recently are these lockdowns. Is the United States going to lock down? Are we going to lock down our borders? Are we going to lock down schools? Are we going to make sure people cannot go in and out of hospitals without being checked? Well, the answer is no. The World Health Organization didn't order nations to prepare for Mpox mega lockdowns either. This is what some people were saying. And I'm not here to spread fear. I'm not here to make you worry. I'm here to give you the facts. The World Health Organization has not instructed anybody to lock down. Now, if cities want to lock down, that's on them. If countries want to lock down, again, it's on them. Is the United States going to lock down? I don't think so. Here's one of the reasons why. Experts say a lockdown, especially after the disaster of the last pandemic, a lockdown right before the election would be devastation to Democrats. Now, whether or not a lockdown is a good idea or not, that's beside the point. That's not the question here. The question is, will it happen? Experts believe that no, it will not happen. Now, here's what I find is very interesting. You go look on social media, you look on Reddit or TikTok, Instagram, you see something. It's this. It says monkeypox outbreak before election sparks do not comply movement. There is a hashtag do not comply. That's what's been going around. Do not comply with lockdowns. Do not comply with vaccine mandate. Do not comply with things like quarantining, right? Just do not comply. Now, this is going to spread the movement, but also the virus. That is what experts are telling us, that no matter what we do, this virus will continue to spread. But we can minimize it. So, just wanted to share that with you, that as of right now, yes, there are some signs that countries, especially over in Africa, right over in India, that they are planning on locking down if we see a potential outbreak. Again, that's if we see a potential outbreak getting closer. They will lock down according to reports. One of the reasons why is because many of these countries have still not rebounded from what we went through during the pandemic. So, as soon as we get more information on this, I promise I'll bring you all the latest news and updates. But as of today, that is all we know. So again, thank you guys for watching. Consider subscribing, and I'll see you guys on the next one.